Hey everyone, Dr. Davis here. So today in this episode, we're going to talk about mold toxicity. So I get tons of questions about this. I have a lot of people reach out to me saying that they think they have mold toxicity or they found mold in their home and they just really don't know where to start because their doctors just don't believe it's a thing. I've experienced it. I've had a lot of patients who have had tons of really weird symptoms. The biggest ones I see in people are neurological symptoms. So if you're someone who, has headaches, migraines, dizziness, lightheadedness, even heart palpitations, you're going to want to watch this episode because this could be the missing link to why you've been having those issues for a long period of time. Chronic respiratory stuff like sinus issues all the time, constantly being stuffed up, skin issues. So mold causes a ton of damage to the gut lining, to the brain. It's really, really bad stuff, you guys. You do not want to mess around with this. And it's so much more common now than it used to be. Because of water damage in buildings and just because of so many other factors I'm going to talk about in this episode. We're going to talk about what foods are commonly found in, what to do when you find out you have mold in your home or when you find out you have mold in your body and how to get rid of it. And I'm going to show you guys a couple of case studies of, people I've worked with who have had mold or people lots of people I've spoken with who have told me all the crazy symptoms they're having because of mold in their system. So stay tuned for that. But I just wanted to start by saying that it's a lot more common than you think it is. Now, I know a lot of people probably didn't used to get symptoms, 50, 60 years ago from living in mold because it just wasn't as bad as it is now today. There's a lot of different factors contributing to that. One of the biggest ones is actually EMF radiation. So there's been, studies showing that mold grows extremely fast when it's exposed to a ton of EMF radiation around it. Pretty wild stuff. I don't know how it affects mold and makes it grow faster, but it's pretty crazy that a lot of times you'll see people who have mold toxicity tend to do really bad when they're around a lot of EMF, like when they're around, very dense concentrated areas in cities that have a ton of Wi-Fi routers or lots of phones being used, lots of computers, things like that. So big issue. So as of now, it's in the United States, 43% of buildings currently have water damage. So that's the number one way you're going to get mold in your system. And you guys, it's not the mold that is toxic to you itself. It's all the toxins that the mold produces when it's inside your body. That's the stuff that really affects your organs, affects your brain, affects your gut, affects so many different systems in your body. It's those toxins being created and released that create massive inflammation, that damage the gut lining, damage the brain, can actually cross the blood-brain barrier and get into your brain and start damaging the cells there, which can be really dangerous. And that's why I see so many people with neurological issues when they have mold toxicity. So big one, hair falling out, hair thinning, that's also a huge sign of mold toxicity as well. So 43% of buildings currently have water damage and 85% of them have past water damage. So you don't really know if mold's growing until you rip into the wall or like bust out a wall and see it in the drywall. It hides in porous material. So wood, furniture like fabrics, things like that. Particle board, which is what most furniture is made of nowadays. So mold is sneaky. It can hide. It's not always visible. So you guys don't rely on your eyesight to know if you have mold in your apartment. For example, I had to move earlier this year. Tons of black mold along the entire wall of my bedroom where my bed was because it was growing behind the furniture. I didn't see it. And even before that, I didn't remember seeing mold behind my furniture, a year prior, but I was having a lot of really minor random symptoms that I couldn't explain. I've never had sinus issues before. I was always, my nose was drippy for about a year and a half. I had, a constant cough that wouldn't go away. I had itchy eyes. I would get headaches every once in a while, and I never get headaches. That's how I know if something's wrong with my body is if I get a headache, I'm just like, oh, what happened? What's going on? So really weird, but you don't always see it, you guys. So that's why it's really important that if you suspect you have mold in your house, if you're getting a lot of random symptoms that don't make sense, if you smell a musty, mildewy, moldy smell, get a professional team to come out and test for mold. All the major forms like black mold that are really bad for you. Stachybotrys is one of the worst ones that causes so much damage. It's actually known to cause cancer in people. So you don't want to mess around with this stuff. It's oftentimes the missing link that I see with people I work with who have crazy symptoms that don't make sense. Out of nowhere, they just get laid out with chronic fatigue or brain fog or, dizzy spells, which I'm going to talk to you about someone I worked with who had crazy amounts of dizzy spells every single day until we figured out she had mold. So Most buildings in the US, unless you're in a newer structure, have water damage, which means mold can more easily grow. Doesn't mean you're always going to have mold, but it's always something to be aware of. So we're going to talk about strategies to, prevent mold, make sure that you're not creating an environment for it to grow. So we'll talk about all that. But yeah, if you live in a humid area too, like tropical areas, I grew up in Florida, so mold is everywhere. I mean, it's disgustingly humid there. You walk outside and immediately have pit stains, even if you just showered. So if you live in an area like that, you're most likely exposed to mold. And this isn't for you guys to go out and be afraid to be in the world and to live in a home and be freaking out all the time that you might have mold. If you're healthy, it should not affect you the same way it does a lot of these patients I've worked with and I'm going to talk to you guys about. So, for example, I had black mold all across my bedroom wall. Like, it was probably 10 feet of black mold in the place that I was sleeping every single night for years. And I had very minor symptoms. And the reason for that is because years prior to that, I had already healed my gut, I had healed my brain fog, I had healed all the inflammation in my body. All those health issues I was having and I was experiencing were completely gone because I had gotten to the root cause, which for me was a massive parasite infection. You can go check out my other video on parasites that I made a couple weeks ago. Really fascinating for a lot of people. You probably never heard a lot of that stuff before, but that was the missing link for me, was massive parasite infection. I had mold toxicity, I had, fungal infection, leaky gut, all sorts of stuff, but I healed it. I spent, a year detoxing, changing my lifestyle, changing my diet, changing out products that I knew had toxins in them that I didn't want to keep putting in my body, working on de-stressing my body, grounding, all these things that are just so important for your health, breathing exercises. And so I was in a really good place physically to where living in that mold didn't wreck me, which was awesome. So if you're healthy, if you get your body functioning at its optimum, this stuff isn't going to wreck you like some of the people that I'm talking about in this video. So don't be afraid. If you find mold in your house, it's okay. It's not going to kill you. It's not going to cause symptoms. A lot of times the stress of worrying about things too much can actually tank your immune system and make you more likely to be infected and be affected by this stuff. So do not freak out about it. You're probably fine. But it's a really, really big thing that I see with a lot of people who are chronically ill, haven't gotten any answers from the medical system, don't know what the heck is going on with them, comes out of nowhere, and their doctors just tell them, oh, there's no way it could be mold. They won't even order a test. We order a test, all of a sudden, oh wow, mold is through the roof. Like, you have massive mold toxicity. And, this is just a problem that is just so prevalent in today's day and age. And so it's just something to really be aware of, but not to be, hyper focused on. So don't watch this video and think, oh my God, I might have mold, and, start freaking out. It's okay. There are ways to detox it out of your body, to mitigate it in your home, to make sure that you're, replacing furniture that might be near the moldy area and things like that. So we'll talk about that in this video. But I just want to say, this isn't to scare you. All these videos I have are just for your information, that if you're one of those people who's had chronic health issues, that I'm going to be talking about the major symptoms of mold toxicity, and nobody's ever checked this on you, you should go get it checked, because this could be the missing link to all the health issues you've had for years or decades or months or however long you've been dealing with your issues. For me, it took almost a decade to figure out I had parasites. And once I did, past like a 3-foot-long parasite, hundreds of other ones, all different shapes and sizes, and my gut has never felt better. I used to deal with massive constipation, bloating, acid reflux, all sorts of bad gut issues. And that's why I specialize in gut health now, because I had such a profound impact once I started detoxing and figured out the root cause was just a chronic infection and leaky gut. There's some other stuff too, but mostly that chronic infection, because holy cow, passing parasites for 6 months. It was disgusting, but also really satisfying. So I also had mold, so I had to get rid of the mold. The mold went away really quickly though. So everyone's different, you guys. Sometimes mold affects people significantly and parasites don't. Sometimes parasites wreck you, and heavy metals don't. Sometimes heavy metals affect other people. So everyone's unique and different. Like, your body has trillions of reactions going on at any one time. You have different genetics than everyone else on earth. So we don't really know the full extent of why certain people react to certain things worse than others, but it's just too complex for us to understand. And that's why it's called the practice of medicine. And we're always discovering new things and new ways to heal people. And so it's just really exciting, because there's just so many ways you can approach and target this stuff to get people feeling better. And it's never the same for every person. So, and it shouldn't be. If you go to a doctor who does the same exact protocol for every single person, go find a different doctor, because you are not the same as even people in your own family. You still have different DNA, different ways that your body functions, different lifestyle patterns, different, social bonds, friendships, relationships. There's so many different things that factor into your health. It's not just one thing. So just want to say that in the beginning, but yeah, do not freak out. It's okay if you have had mold in your home before. I've seen people who don't react at all to it. I have people reach out to me all the time saying, I feel super sick. I'm pretty sure I have mold toxicity, but my husband is totally fine, or my wife is totally fine, and we live in the same house. What the heck? Your body is completely different. You have completely different stressors, completely different gut function, completely different brain function, completely different, gallbladder, liver function. So you guys, it does not affect everyone the same, but this video is for those of you who have been like, I don't know what the heck is going on, but something is very, very wrong with my health and I don't know what it is. So let's go over some of those common symptoms that I'm talking about. Some of you are probably like, what the heck, do I have mold? So the biggest ones that I see are neurological issues. Lightheadedness, dizzy spells, migraines, headaches, brain fog is a big one, chronic fatigue is a big one. Anything that's really just gonna wreck your nervous system and just, completely just knock you out, neurologically, energy-wise, because it does attack the mitochondria, which is the powerhouse of the cell in your brain, so it can create a ton of energy and fatigue issues with people. So those are the biggest ones I see. One of the most common symptoms that I find in people that nobody ever thinks about is heart palpitations. So if you're someone who's like, I don't know what the heck is going on, I've been to a cardiologist, I've been to the ER multiple times thinking that I'm, having a heart attack, and every single test shows up normal, you probably have mold toxicity. It's one of the number one infections that can create, sudden fluttering and heart palpitations in your chest that don't make sense, that don't show up on EKGs, that don't show up on any other cardiology testing or stress tests or anything like that. So if you have heart palpitations that, you've already gotten the standard stuff ruled out, that it's not cardiology related, it's probably mold. I see that on so many people. And you guys, once we start detoxing and removing the mold toxins, those mycotoxins from people's body, all of a sudden the heart palpitations go away and they're like, oh wow, my heart's normal again. I'm just like, yeah, because the mold is attacking it. And now that we remove the mold, you're not having it as much. So for example, I was just on a phone call this morning with someone I'm working with, and she was having heart palpitations every single day. They had just found mold in their bathroom at their home. They had got it remediated professionally, so they did a great job there. But she was still having symptoms from it because she didn't know how to get that stuff out of her body naturally. She was having gut issues. The gut is the number one organ that gets toxic waste out of your body. So if you have gut issues mixed with an infection, it's going to be really hard to get the toxic waste out. And so that's why you need a little help with detoxing. So we did that for her. After less than a month, she went from having heart palpitations every single day to once or twice a week. And it's not as long, it's not as intense. And she's doing so much better in so many other areas of health. So you guys, heart palpitations are a big red flag. If nothing else is explained in cardiology exams, it's mold, most likely. So I always want to mention that because people don't think about that one. It's a very common one. Also, sinus issues. If you have chronic, I'd never experienced allergies, sinus issues my whole life. So I was getting constant dripping or stuffiness in the nose and dripping in the back of the throat that I'd never had. And it went on for like a year and a half. And I was like, what the heck is going on? I just thought it was stress. It's because I was living in mold and I had no idea. So, because once I, got out of that place, started living somewhere else, all those symptoms, I know how to detox. So I just went on a quick little, got the right binder, supported my gut, supported my gallbladder, all those drainage pathways, my liver, was doing castor oil packs every day to support the liver. All that stuff went away within like a month or two. So, but I already knew what to do. I was already healthy. I'd already done this before. And, obviously I'm a doctor, so I know exactly what to do to kind of mitigate this stuff. So it made it a little bit easier, but chronic sinus issues are a big one for mold. So that could also be chronic cough because, part of your respiratory system is your lungs. A lot of different types of mold, especially aspergillus, which is commonly found in homes, will attack the respiratory system specifically. So the other ones tend to attack more brain and gut. But everyone always associates, mold toxicity with respiratory issues. It's not. The most common symptoms I see with people are gut issues and brain issues. So I don't see that many people who have, the actual aspergillosis where it attacks the lungs and, causes all sorts of bad issues. But that can definitely happen to people who work in mold remediation. So that's why they wear all that gear that protects them so they don't breathe it in, because you do not want to be breathing this stuff into your respiratory system. It'll wreck you. So Chronic sinus issues, rashes. So if you're someone who has a lot of skin stuff that just randomly popped up, you've never had issues with it before, it's not hormonal related. I'm not talking about cystic acne and stuff like that. I'm talking more like rashes, hives, random dry patches like eczema, things like that can be caused by mold. Brain fog, huge one. If you just feel out of it all the time, if you can't focus, if you can't concentrate, if you lose your train of thought when you're talking to someone, if you walk into a room and forget why you're there, that's brain fog. So that's just feeling like your brain is just so slow and you just can't really, compute everything that you're hearing or seeing or saying. And so it just makes you feel kind of like your head is like underwater and you're just out of it. So not fun, not a good way to live, especially if you have a high stress job or you have kids to take care of. So it can definitely really affect people's, quality of life, which is not good. So yeah, we already talked about headaches, migraines, because it crosses that blood-brain barrier, can attack the brain, causes inflammation in that, the nervous system, which is your brain, spinal cord. So you can get lots of weird, I've even had people come to me with random nerve pain that didn't make any sense, mold in their system, yeah. So because it can cause inflammation in that, that whole nervous system. So even the spinal cord, which is kind of scary. So not very common. I usually see the other issues more, but definitely something that can happen to a lot of people. So if you have any of those issues, keep watching this episode. You're going to get so much out of it. So, and just know, you guys, this stuff is easily healed. You just have to do it the right way. So I always talk about, if you're going to do a detox, if you're thinking about doing one, make sure you do it the right way. And I'll talk about that at the end of the episode about how to fix this stuff. But just know, don't go out and just buy a mold detox kit. You're going to wreck yourself and feel worse. And I've seen that so many times where people get really bad detox reactions because they don't understand how the body works and how to attack different things first. And make sure you're supporting the organs that do get toxic waste out of your body before you start dumping a bunch of toxins into that system. So otherwise you get really bad detox reactions, which is not fun. Alrighty, so let's get into how mycotoxins, so you guys, I'm going to use this term for the rest of this episode. It just means mold toxins. These are the toxins produced by the mold that actually cause damage to your body. It's not the mold itself that causes the damage, it's the toxins they produce. Same with parasites. Well, actually parasites do kind of destroy your body if they move through tissue, but kind of the same concept where the parasite itself, a lot of times it's more of the toxins it releases that causes so much damage and inflammation in your body than it is the parasite itself. But there are certain parasites that can, travel through tissues and create a lot of damage along the way. So, but in general, mold produces what's called mycotoxins. So these can, create a wide range of symptoms that do not make sense. If you're someone who's been lumped into one of those categories of diseases that literally doesn't make sense, there's no, there's no mode of how this happens. Oh, we don't know why it happens. It's, idiopathic, if you ever hear that word. Things like chronic fatigue syndrome, fibromyalgia, mast cell syndrome is a new one I'm hearing of. Anything with itis at the end of it. People will message me and be like, have you ever worked with someone who has gastritis? And I'm like, yeah, all that is inflammation of your stomach lining. But what's causing the inflammation? That's what we got to get to the root to. It's not the diagnosis that matters, you guys. So if you're someone who's been grouped into one of those categories and nobody's been able to figure out what the heck is going on, you could have chronic infections or toxins that are just triggering a lot of these issues. So for example, mold can create tons of energy issues. I've seen that so many people. Weakness, memory problems, headaches, a lot of the stuff that we already just talked about. Shortness of breath is also one. People have respiratory issues. Chronic abdominal problems, so gut issues. So we're going to talk about how and why mold attacks your gut. It's pretty bad. So the mycotoxins actually impair your gut health on not just a structural level, but a functional one as well. So they can damage that gut lining, create what's called leaky gut. So for those of you who don't know what leaky gut is, basically the cells in your intestines have a pretty tight junction that only allow nutrients to kind of slip through into the bloodstream, but it basically separates your intestines from your bloodstream. You have to have that separation because you don't want toxic waste going into your blood, because that's when you get chronic inflammation throughout your entire body and other organ systems start failing, you get joint pain, all that stuff. So fibromyalgia, I think there's a huge link with leaky gut. Almost every single fibromyalgia person I've worked with has leaky gut show up on testing. Because when you get toxic waste going into your bloodstream and it goes everywhere else in your body and lodges into joints, organs, tissues, muscles, all that stuff, of course you're gonna have chronic pain everywhere. So big thing. Obviously there's other stuff going on too with that. It's not just leaky gut, but that is a pattern I see with a lot of people who have chronic pain, because if you have a really bad gut lining where it's just loose and there's all this toxic waste and infections and everything just flowing back into your bloodstream, it can go anywhere in the body and lodge anywhere in the body, because your body's going to try to pull it out of the bloodstream so you don't, get really sick and really messed up, and it's going to store it in fat cells, which is why a lot of people have trouble losing weight when they have a lot of toxins in their body. It'll store it in organs, tissues, joints, wherever it can get it out of the bloodstream so that it's not putting a ton of stress on your liver. That's where it's going to put it. So really bad. So if you've been in one of those categories of diagnoses, it's, pretty much everything starts in the gut, you guys. So that leaky gut, when that happens and you start getting a lot of damage to that gut lining, it starts to swell and become inflamed. Inflammation is the root cause of pretty much every disease. We've known this for years, but we got to figure out, okay, yes, we know there's inflammation. What is causing it? So that leaky gut will just start to look like this, and now you get waste products, you get food particles, which is why a lot of people all of a sudden become, gluten sensitive or allergic to milk as an adult. That's not an allergy, you guys. That's a breakdown of your gut lining that's causing large food particles to slip into your bloodstream. And now your immune system is like, what the heck is this food doing in the blood? And it tags it as a foreign invader. So every time you eat that food, it mounts an immune response. And now all of a sudden you can't eat eggs, you can't eat dairy, you can't eat bread, you can't eat, tomatoes or nightshades or all those common food sensitivities that people get as an adult. It's a breakdown of your gut lining. You got to heal the gut, guys. And first of all, before we can heal the gut, we got to figure out what's damaging it in the first place. Is it mold? Is it parasites? Is it toxins? Is it all these other things? And remove those stressors so that gut lining can heal and actually go back to normal and have those tight junctions. So now mold, that maybe you eat and ingest and that's, in your intestines can't slip into your bloodstream and go systemic. So, because you do also get mold from food sources. And I'm going to tell you the top 2 food sources that are probably going to make y'all cry, because it's probably something you eat or drink every day. So, but it's okay, you guys. Once you heal yourselves, you can be exposed to little bits of mold and your body is able to get it out of your system and you're totally fine. So I just went off on a huge tangent, but we're going to bring it back here. So leaky gut, big issue, because when you have those tight junctions, infections slip through like mold, other toxins, because you have to remember your fecal matter is just a bunch of toxic waste that's going into the toilet bowl. If you have leaky gut, not all of it's going in the toilet bowl. It's slipping through back into your bloodstream, and now you just have sewage in your blood, which is really bad. So, and then your liver starts working overtime and starts getting damaged and, not functioning as well as it should, because that's what's responsible for detoxing your blood. So it creates all these downstream effects that are just really bad for people. And I'm gonna have a longer video on leaky gut at some point, because it's just such an important topic and I talk about it so much, and I find it on so many people, especially in America, because 80% of the garbage we add to our food, the chemicals, the additives, the preservatives, the food dyes, are all banned in other countries like Europe, which is why if you're someone who can go to Europe and eat dairy and bread and have no issues, that's why. So our food supply is a huge contributor of this leaky gut. Mold is another one. Damages that gut lining, and now all of a sudden, because you have leaky gut, you're destroying the good bacteria. So for those of you who don't know, you have a ton of bacteria in your gut. You got good bacteria, bad bacteria. We obviously want the good to outweigh the bad, but a lot of times what happens is when you get mold infections and it just destroys those good bacteria, now the pathogenic or the bad ones can start overgrowing and creating a ton of issues. And now you get things like SIBO or other bacterial infections in your gut that are creating IBS symptoms, or, Crohn's or colitis, or, whatever diagnosis you want to put to it. It all starts with inflammation, which is caused by these chronic infections. So mold is really bad for your gut. Really terrible. Your gut is your second brain, and it also attacks the brain. So it's basically just wiping out both systems at the same time, which is not good. And because you wiped out this good bacteria, now your hormones are going to get messed up, because for those of you who don't know, you have bacteria in your gut that help regulate hormones, which is really important. And now you can't absorb nutrients because those bacteria also absorb nutrients. The gut lining absorbs nutrients. If that gut lining is damaged and inflamed, it's not going to do it very well. So then you get nutrient depleted, which creates a ton of health issues as well. So it's all these downstream effects that start with these infections. And then obviously tons of inflammation. If you're releasing toxins in the body, it's going to cause tons of inflammation in the gut lining, which creates a lot of those, issues going to the bathroom, like constipation or diarrhea or bloating, or acid reflux, all these issues that people have nowadays that they assume are normal or part of aging. It's not, you guys. You should not have these issues, especially in your 30s, especially in your 40s, 50s. Like, you're still young. This stuff is more common, or it used to be more common in elderly people, but now we're seeing it so much in younger people. And one of the biggest things that mold will do, once it destroys that gut lining, now you're much more susceptible to getting other infections in your body. Things like viruses, bacteria, parasites. So it basically creates a bad environment in the gut that allows all these other infections to overgrow and become a problem. And also 80% of your immune system lives in the gut. If you destroy that gut lining, you've lost most of your immune system or your ability to fight off other infections. So that's why you see, people who, they didn't just start with chronic fatigue syndrome. They started with small issues that snowballed over time and just became these bigger and bigger and bigger issues that all of a sudden led to a complete shutdown of the mitochondria in their body. Or people with cancer, that stuff takes decades to develop, and it's just the environment of your body. Like, what's going on in there? What symptoms have you ignored that you thought were just okay or normal? And now they're just snowballing into a bigger effect. Because if one thing breaks down, especially the gut, your whole system breaks down. It's so bad. And that's why I focus so much on gut health, because I've seen for myself and my patients how incredibly important it is for mental health, for neurological health, for hormone health, for so many different systems in your body. So you guys, this is really, really important. And that's why it's so important to understand, like, your gut issues could be from mold. It's not always parasites. It's not always bacteria or viral infections. It could be from a mold infection that you're just not aware of. So yeah. And those two foods that I mentioned earlier, two of the most common sources of mold exposure in food are peanut butter. Has high amounts of aflatoxin. So if you're going to get peanut butter, go to one of those stores that lets you grind it yourself. It's just going to be the most pure way to get peanut butter, and you're going to be able to see if there's actually mold on the peanuts. So aflatoxin is really high in peanut butter. And then the other one is coffee. So if you're going to drink coffee, try to get organic beans, you guys, things that aren't sprayed heavily with pesticides, things that have been mold tested. You'll see that on a lot of coffee brands now, is they'll say like tested for mold or mycotoxins. That's really, really important. So you're reducing pesticides, you're reducing your chance of getting mold exposure. But those are the two of the top foods that have mold, guys. I know, I'm sorry. And then number 3 is probably grains. So breads, pastries, cakes, all that stuff tends to have high amounts of mold in it as well. So yeah, I know, but it's okay. If you're healthy, go ahead and eat your peanut butter and drink your coffee. You can do it together if you want to, or separately. But if you're having health issues and you suspect, like maybe you're watching this video and you're like, wow, I have every single symptom she mentioned, maybe stay away from coffee and peanut butter for a while. Try not to add to that, the toxic load that everyone has that's kind of filling up. Try not to add to it and make it worse, Try to remove some of the stressors. That's what I do with a lot of people I work with is, hey, in the beginning, while you're healing, let's remove a lot of these stressors that are adding onto that toxic bucket that's overflowing and spilling out right now. And let's try to limit the amount that we're adding on. And then as your body heals, we can slowly start to add that back in at small amounts and not have the same bad reactions to it. So it's not about cutting everything out of your life that gives you joy, because nobody wants to live like that. Like, eat your dang peanut butter, drink your coffee. I love coffee. I don't care what anyone says. I'm still going to keep drinking it. So I try to go to coffee shops that have they use organic beans, but not all of them do, and that's okay, because I've healed myself. I do daily, weekly, lifestyle things that help keep my body healthy, so that I'm not, affected as much as, people who are unhealthy. But that's the importance of, like maintaining those lifestyle changes, guys. It's like, you want to maintain the results and the health that you currently have. Don't just, feed your body garbage and put garbage toxins and lotions and shampoos all over your body. It's, treat your body like a temple. It's biblical. So, all right. But yeah, mycotoxins increase the levels of harmful gut bacteria and deplete the good bacteria, which we already talked about. So super important. I did microbiology as my main major in college, a double major, because I was going to go to medical school and then decided not to. But the biggest thing we focused on, and which basically microbiology, for those of you guys who don't know, is the study of how infections affect the human body, which I thought was really fascinating. I wanted to be like Dr. House, that's why I wanted to go to med school. It's kind of cool that it turned around full circle to where now, I'm doing that. I'm trying to figure out, what is the root cause in people's health issues and how can we, treat them to get them feeling better and back to normal. So the biggest thing we focused on in that whole major, like 80% of the stuff we talked about was the gut bacteria. They are so incredibly important for your health, you guys. Anything that's going to wipe out that good bacteria in your gut, antibiotics, birth control is a big one for those of you who don't know. It actually acts like an antibiotic in your body, which I think is why most of the patients I have are women, because almost every single one of them has been on birth control at some point in their life. Men tend to not have as many gut issues as women do, at least in my experience. And I think a lot of that is just because of long-term use of birth control. Antibiotics are a big one too. Toxins in your food, pesticides, all that stuff just damages the good bacteria, creates so many issues, mold being one of the biggest ones that can do that as well. So depending on the type of mold you're exposed to, some of them can really destroy that gut, which leads to leaky gut, which can lead to all those things I just talked about earlier. Mold can even cause weight loss and malnutrition in some people, which is kind of crazy. So, and again, I think it's just because it damages that gut lining so badly that you can't absorb nutrients. Even if you're eating enough, calories and eating all the right foods, your body is just still very, very nutrient depleted and nutrient deficient. So if you're someone who's like, yeah, I've been losing weight and I don't know what the heck is going on, and like I've been, obviously everyone freaks out because they're like, oh my God, do I have cancer? Because that's, one of the number one signs. And they've done all the testing and they're like, yeah, nothing popped up that made me think I have cancer. It's like, great, that's awesome. You might have mold. So that could be something, or another infection like parasites will do the same thing. They'll basically slow down digestion so they can feed off your nutrients and zap you of all the food that you just put in your body. So yeah, these infections are just crazy. It can also lead to SIBO. So for those of you who don't know, bacteria, if you're getting chronic bacterial infections, it's probably not bacteria that's the problem. And the reason for that is because it's all these other infections that damage that gut lining and allow the bad bacteria to overgrow that are actually the root cause. So if you're someone who's been like, yeah, I constantly have SIBO and I'm getting treated for it, or, UTIs or whatever other chronic bacterial infection is going on in your body, it's probably parasites, it's probably mold or heavy metals or fungal infection, because those all damage the gut lining and create an environment for bad bacteria to overgrow in that gut, which creates a lot of these issues. So you guys, bacteria are kind of the thing that show up. They're rarely ever the thing that causes the problem, at least in terms of gut issues. So it's usually an indicator of, how healthy your organs are. Because if you've ever gone out to eat and everyone got food poisoning except for you, you're probably the healthy one in the group, so yay for you. But if you're someone who goes out to eat, you eat the same things as your friends or your boyfriend or your girlfriend or your wife or whatever, and you get really sick and nobody else did, you guys, it's not food poisoning. It's the fact that your gut is so unhealthy that the bacteria in that food that you ate, your body wasn't able to process it like everyone else, and so it made you sick and ill. And it's not the food itself, you guys, it's the fact that your gut is so damaged and so, broken by all this stuff that you haven't addressed. And so it just makes you really sick. 80% of your immune system lives in the gut. If you don't have good gut function, you don't have good immune function. So it's not the bacteria that are the problem, you guys. We're exposed to bacteria all the time. We have more bacterial cells in our intestines than we do cells in our entire body. So you guys, we have those bacteria in our body already. It's when they overgrow and that, that homeostasis gets way out of whack, that's when it starts to cause issues in the body. So yeah, just something to consider is that these chronic infections can lead to other infections overgrowing and creating issues in the body. And that's why it's so important to get tested for all the infections, not just one. Because if you have a bacterial infection pop up, your doctor's gonna be like, great, let's put you on an antibiotic. It's gonna kill your gut and allow, if the root cause is the mold or the parasites or the fungus, you're just creating a worse environment. And now when they start to grow back, it's gonna be worse than it was before. And I've seen this with so many people who reach out to me who are like, yeah, I took antibiotics and then my symptoms got, 10 times worse like 3 months later. And it's like, yeah, because the bacteria wasn't the problem. The bacteria was the thing that showed up to the scene, but it wasn't the thing that created the damage in the first place. So it's usually an underlying infection or an underlying toxin, or maybe the gallbladder's not functioning well, because that's a huge part of killing off the bacteria and the parasites that you eat in your food. Or maybe you had your gallbladder removed, which is not good. So yeah, causes all sorts of issues. Mold causes what's called oxidative damage in the body, which basically is just, that thing that forms what's called free radicals. If you guys have heard that, that's what can cause cancer, chronic inflammation in the body. So really, really important to not have that happening, especially in your gut. So that's how mold affects your gut. It's pretty terrible. Also, if you already have pre-existing gut issues, mold is going to affect you significantly worse. And we've already touched on this, immune system's in the gut. So of course, you're going to be much more affected to every single infection that you're exposed to if your gut doesn't function properly, which is why you should never ignore bloating or acid reflux or stomach pains or constipation or IBS, because that is a precursor to where if you just leave that alone for 10, 20 years, it's going to blow up into something worse like autoimmune disease, which starts in the gut, starts with leaky gut. It could trigger fibromyalgia or cancer or all these other chronic diseases that people have nowadays. So do not ignore gut symptoms, you guys. They're so indicative of the full health of your body because they interact with every other organ system in your body. It's kind of crazy. Your gut bacteria even communicate with your lung tissue, which is crazy. I didn't know that until like 6 months ago. So that was pretty wild. Your gut bacteria also communicate with your brain. So if you want better brain function, you got to have a better gut. If you don't want to have Alzheimer's, dementia, Parkinson's, all that stuff later on, fix your gut, guys. Start there. The gut is everything. All right. So we already talked about this. So yeah, that's how it affects your gut. Again, the way to fix this stuff, you guys, is you've got to figure out what is the root cause. Let's not focus on the symptoms. Let's not focus on, oh, my doctor ran a bacterial test and I have, this overgrowth of bacteria, so he wants to give me an antibiotic. Well, has he tested you for anything else? Do you have fungus overgrowing in your gut like candida? Do you have parasites? Do you have mold? Do you have heavy metals or chemicals in your body that are just destroying the gut lining? Do you have leaky gut? Because if you don't get to the root cause, they're just going to throw a Band-Aid solution on the problem and you're not going to get fixed. And you guys, your medical doctor is probably not going to run these tests that you actually need. You're going to have to go to a functional medicine doctor or a naturopath who's actually going to look at, okay, what infections are in your body? What toxins are in your body? Do you have leaky gut? Let's start at the gut first. Let's go after the liver or the gallbladder issues. Those are your 3 organs that get toxins out of your body. If you don't heal those first, you're gonna have a lot of trouble when you start detoxing mold or parasites or whatever other infections or toxins popped up on your test. So find someone who knows how to test for this stuff. That's step number 1. Remove the stressors, whatever pops up. Work with a professional who knows what they're doing. Get on some binders that are going to remove mold or parasites or whatever shows up on your test, something that's going to remove heavy metals. If that pops up, remove the stuff that's damaging the gut and then focus on healing the gut lining with nutrition. Because if you just start with diet, you're probably not going to get better. If you start with supplements, you're probably not going to get better. You've got to remove what is causing constant damage to that gut lining. Remove that first, and then let's focus on adding in the bone broth and, focusing on more good quality foods and actually diet and, all that other stuff. But you've got to remove these triggers. Otherwise, you're just going to have constant damage and inflammation in your body. And it's going to be really hard to heal from it. So that's how to kind of heal from that issue, especially if you have gut stuff going on. But yeah, you don't want to mess around with mold. It's bad stuff. So, all right. So let's talk about why mold affects your brain and how it affects your brain. So this, again, probably about 80% of the time, I see neurological issues with people who have mold. So usually people reaching out to me who have mold issues, chronic sinus issues, skin rashes, brain fog, fatigue, all these issues. And my first question is, have you had your house tested for mold? Oh yeah, we just found it. We had to move. I'm like, okay, well, that makes a lot of sense with all your symptoms that you're having. And people just don't know how mold can affect them. Like, this stuff is bad, you guys. It's not something you want to take lightly. But there are 7 big effects on the brain that mold has. So let's go over those real fast. So cognitive impairment, we already talked about that. Brain fog, difficulty concentrating, focusing, memory issues can even pop up from mold dysfunction, from mold toxicity. Chronic fatigue, I already talked about that, because these mycotoxins attack the powerhouse of the cell, those energy producers, the mitochondria. So they cause a lot of mitochondrial dysfunction. Neurodegenerative diseases. You guys, there's a specific subtype of Alzheimer's disease called inhalational Alzheimer's disease from inhaling mold. And it also is found to play a role in the development of ALS and Parkinson's disease, which is really scary. So we're seeing a huge rise in all of these brain issues in younger and younger people nowadays. And there's many different factors, but the biggest ones, you guys, are toxins and infections. If you just let these linger in your body for decades, they will eventually cause something to break down. Depression and anxiety. So there was a study in the American Journal of Public Health that found those living in moldy environments had significantly higher rates of depression compared to those living in mold-free environments. And these people who suffered from depression also, most of them also had anxiety. So mental health, big thing, you guys. And the reason for that, again, think about that damage to the gut lining. There are certain gut bacteria that produce serotonin and produce dopamine and store it in the gut. And those are the happy chemicals that make you joyful and not depressed, not anxious. So of course, if you're having something that's chronically damaging your gut lining, you're gonna have mental health issues. That is your second brain. That's where I believe it's 95% of serotonin is stored in your gut, not in your brain. It's not a brain issue, guys. It's a gut issue. And I think it's around, there's different studies that say different numbers, but 50 to 70% of dopamine is stored in your gut lining as well. So huge thing for depression, anxiety. I've had many patients, we fix their gut, and all of a sudden their depression, their anxiety gets 70, 80% better, which you just see them light up. Like after 6 months, they're just a different person. It's so cool. I even one person, her panic attacks went away. So that was really awesome. She had them, for years and completely gone after 3-4 months of detoxing. So a lot of this stuff, you guys, the infections can create mental health issues. People don't realize, like, maybe that's an avenue you need to look down in addition to therapy, in addition to, if you have PTSD or trauma that you're trying to work through. Let's look at infections. Let's see if there's something that could just be triggering all these issues, because I've seen it happen so many times where people's mental health drastically improves. And I even had one patient who'd had depression for, 4 or 5 decades, completely gone after detoxing. So, and there's a correlation between parasite infections and depression and anxiety as well. So she had parasites, that was her big infection, and depression completely gone, after 4 or 5 decades. It was crazy. So this stuff is profound, you guys. Like when you realize that a lot of the stuff you've been diagnosed with is just a chronic infection that nobody's ever addressed, and then you get it addressed and you feel like a completely different human being, it's life-changing. Like I didn't know how many areas of my life the parasites were affecting until I removed them out of my body, especially that 3-footer. Holy cow, that thing was big. Like it had been in there for decades. My whole life changed. It wasn't just the gut stuff. It was the inflammation went down. I had more energy. I could focus better. My brain fog wasn't really there anymore. It was completely gone. And I just had so much more life and energy in me to actually enjoy hanging out with friends or, like hanging out with family, going on trips, exploring nature, swimming in the ocean. Like I just had so much more motivation and energy to do things once I removed the chronic infection. So, and for a lot of people that's mold, their whole life changes when they just realize like, oh, I have mold toxicity, and you remove it and all of a sudden brain function improves, respiratory system improves, their sinus issues go away, their gut issues go away. It's amazing. All right, there's also a lot of research showing, and this is just correlation. You guys, obviously we're still studying autism and we don't really know for sure what is causing it. I think there's a huge role in toxins and infections, especially since they found in so many different studies that if you heal the gut in autistic kids, it actually improves their symptoms significantly. So I think it starts in the gut. We still don't really know, but there's emerging research indicating that children with autism have higher levels of mycotoxins in their urine compared to their peers without autism, suggesting a relationship between mold exposure and autism. So that's pretty profound. Now, again, is it the gut issue that's tanking their immune system and making them more susceptible to mold? Maybe. Is it, because I know a lot of autistic kids have gut issues, so is it the fact that their gut is already damaged and that's what's making them more susceptible? Or is there a correlation between getting exposed to mold at a young age and then later on seeing those symptoms crop up in kids? Who knows? Like we don't really know, there's not enough research on it yet, but pretty interesting. Psychosis. So there's a big relationship between mycotoxins and psychosis or hallucinations or psychotic episodes in people. Traumatic brain injury. So a lot of the neurological issues you see in people with mold toxicity are very similar to those who have had a traumatic brain injury before. And as someone who has had a traumatic brain injury before, which that was crazy. Like I healed from that completely. It was wild, but that's what started me on my neurological journey before I got into functional medicine. But brain fog, massive. If you have sudden emotional changes like anger issues, or you get suddenly depressed or anxious after head injuries, that's really common. So a lot of the stuff we're seeing in people with mold toxicity is very, very similar to people who've had head injuries before. So always wear your helmet. That's why I'm still normal, because I had a helmet on and the helmet cracked instead of my skull. So that was great. But yeah, so a lot of these symptoms that people have with traumatic brain injury, like impaired learning, doing poorly in school, not being able to focus, concentrate, memory issues, all this stuff is very, very similar to how mold can affect your brain. It'll cross the blood-brain barrier. It damages those neurons in your brain that actually allow you to think and to learn and to remember and to, actually use your brain well and use it properly. So I struggled with that for years before I met someone who actually knew how to fix it. And then it was wild how well it worked. So for those of you out there who have had a traumatic brain injury, go find a functional neurologist or somebody who does Z Health. It's usually a lot of personal trainers, but they're really, really good at analyzing the brain and giving you exercises to balance out the brain and get you feeling better again. So those two techniques are really amazing. If you've had a traumatic brain injury or head injury, or you know someone who did, I would definitely find someone in those two fields to check them out, because that stuff is phenomenal. It saved my brain, so that was pretty crazy. Alrighty, and now I can use my brain to educate everyone on all these infections, so it's exciting. All right, but yeah, so those are the main things that happen with mold in the brain, and the reason is because there are certain mold toxins that actually cause, like I talked about earlier, damage to the mitochondria in the brain. So that's remember the powerhouse of the cell from high school biology, that's what produces all your energy. There are significantly more mitochondria per cell in the brain than there are anywhere else in the body, which makes sense because we need, a ton of energy to actually function because our brain controls everything. So if you have damage to the mitochondria in your brain, that causes significant downstream issues because your brain controls everything. It controls your heart rate, heart rhythm, which I think is why people get heart palpitations when they have mold, because it attacks the brain so much. I don't really know, maybe it does attack the heart, but I think a lot of it is brain related. Those mycotoxins also interact with what's called the neuroimmune axis, which is a network of cells and signaling molecules that links the immune system and the central nervous system, which is your brain and spinal cord. So they basically activate what's called mast cells, which triggers a release of a bunch of inflammatory molecules in your brain, which is not good. So, alrighty. But yeah, and they cross the blood-brain barrier. They can compromise the integrity of your blood-brain barrier to where, like the gut can become leaky gut. You can damage that blood-brain barrier to now where other things can, cross over and start damaging the brain as well, which is really, really bad. So mold is bad, y'all. Attacks your brain, attacks your gut, causes all sorts of health issues. So definitely don't take it lightly, and just know, if you ever come across mold, the first thing you want to do, any furniture that is in the vicinity of the mold, so within 6 to 8 feet of the mold, especially if it's a huge area, probably everything in the room you should dump. You're going to want to throw that all out if it's a porous material. So if it's wood, if it's particle board, if it's fabric, toss it. Mattress, bed frame, unless the bed frame's metal and you can easily clean it. If you are keeping something, you're always going to want to clean it with either distilled white vinegar or a mixture of bleach and water. So I think it's 1/3 bleach, 2/3 water. I think vinegar works best, especially if you're gonna try to clean it off the wall yourself, which I would not recommend. So if you're gonna try to clean surface level mold off the wall, use bleach and water. If you want to if it looks like it might be deeper, again, I would get a professional team to come do this, especially if it's black mold. You're going to want to use white wine vinegar. So when I was moving and I was cleaning off all the stuff in my room that I wanted to keep, like all the books, my friends came over and we all had a cleaning party with our masks and our suit on, cleaning all my books with white vinegar. So they smelled real funky for the first month that I lived in my new place, but I was like, I am not taking any of this mold with me. The books were on the other side of the room, so they're safe. And I researched it a lot, and everyone said, books, they're not very porous, so it's not going to hold mold. So as long as you clean, the cover, the binding, even the pages that are exposed, then you're totally good. But yeah, anything fabric, anything wood, anything particle board, toss it. Clothing, put it in the wash, maybe run it twice, just to be sure that you got all the mold off of there. Maybe throw a sprinkle of vinegar in there, just to make sure that you're getting the mold out of your clothing. And yeah, any clothing that has mold on it, just toss it, you guys. It's not worth it. If you keep something because you really don't want to get rid of it, and you move to your new place, and now all of a sudden you bring the mold from the old place to the new place, and then you got to deal with it again. That's going to be a nightmare. So you guys, I had tossed like 80% of what I owned. It was bad, but I didn't want to bring any of that stuff to my new place because I know the effects of mold, and I was like, I don't want to deal with this twice too. It was a pain in the butt to have to clean everything and move it and pack it and like keep everything sequestered so the mold didn't spread to anything else in the apartment. So it was just a mess. So you guys, if you find mold, throw things away, clean it with vinegar, clean with bleach solution. Okay, so some of the crazy symptoms I've seen very commonly with people who reach out to me on Instagram. Chronic fatigue, can barely get out of bed, can't function, had to quit my job. Those are the severe symptoms of mold toxicity I've seen. I even had a woman come in to see me who had lost like 80% of her hair because it causes a lot of hair thinning. So for those of you who have hair loss that's unexplained, especially if you're young and it just doesn't make sense, probably mold toxicity if it's not hormone related. So those are the big things. Those are the major symptoms I've seen. One of my patients I want to talk to you about, she actually came to me because she started randomly having 10 dizzy spells per hour. Anytime she moved her head, just, completely felt dizzy, lightheaded out of nowhere. And she was healthy her whole life. Didn't make any sense. We did a test. She had mold toxicity off the charts. So yeah, after 4 months of detoxing her, and she'd been seeing me as a chiropractor for migraines for about, 3 years at that point. And we had gotten a lot of results with like the neurology stuff I used to do with people. That's why I have this little brain poster here, because I used to fix people's brains, especially people from concussions like I had. So once that doctor fixed me, I was able to use that to help other people. So we had a lot of progress to where she was only getting them maybe once a month. We did a 4-month detox, got the mold out. She was doing great. All the dizzy spells went away after like 2-3 months, which was amazing because 10 times an hour, can you imagine living like that? That's scary. And she ran her own business with her husband. So it was just a lot, it was hard. She worked long hours. She was having all these health issues, but all the dizzy spells were gone. And as a bonus, because I didn't know this could happen, I didn't know that they could trigger migraines. All of her migraines went away. She didn't have a single migraine, in months after she was done with the detox, which was so cool because we'd been trying to figure that out for like 3 years and it was just an underlying infection. So sometimes it's an infection, you guys. Sometimes if you just figure out what's going on, detox the body, get rid of the infection, all of a sudden random symptoms heal that you didn't even know were related to that infection in the first place. So that was pretty cool. So she was a really, really good case study. I've had tons of other people show up with mold toxicity, usually brain fog. If they're just having like moderate issues, it's typically brain fog that I see with a lot of people. Mold or heavy metals, they typically attack the nervous system. I also have people reach out to me who have like crazy nerve pain that no doctor can explain. And, I've messaged people and been like, you should get your house tested for mold or go get a blood test or urinalysis test. And this one woman fought her doctor until he finally ordered a urinalysis test to see if she had mycotoxins in her system. They were off the charts. Like the doctor looked at it and was like, I don't know how this is possible. This is crazy. So it's kind of cool because he realized like, holy cow, these symptoms can actually be caused by an infection. I was never taught that in med school. This is crazy. And, she was able to finally have an answer for why she was having crazy nerve pain that didn't make any sense. So heart palpitations are another one I see in almost everyone who has really bad mold toxicity. So this stuff is bad, you guys. Causes a lot of issues, but just know that healing is possible. You just got to figure out, are my organs functioning well enough to handle a detox? And if not, let's heal those first. And then figure out what infections and toxins are in your body. Remove everything at once. Don't just go after one infection because oftentimes they work together. Remember, like mold creates an environment for bacteria to overgrow or parasites to overgrow. So it's not always the bacteria, it's not always the parasites. Oftentimes it's something else triggering the environment for that stuff to get out of control. So check everything, remove everything. You're gonna feel amazing. It's gonna be great. If you guys have any questions, please let me know in the comments. I think I covered everything, but if I forgot something, definitely remind me and I'll just, comment on it in the comment section to finish that gap. So if you guys like this video, hit that subscribe button below, like the video, comment if you have any questions. I'll get back to you as soon as I can, and I will see you next week on the next video.